ruin and destitution. Fellow countrymen, our universal health coverage plan seeks a paradigm shift in the provision of health care from curative to a largely preventive and promotive approach. Our radical transformative plan has seen the enactment of 4 acts of parliament, which I thank our legislature, as well as the rollout of 100,000 community health promoters, for which I thank all county government for participating. I commend counties who have already paid community health promoters their stipends and commit that the national government will pay our portion beginning the end of this month. The laws we have enacted now provide a framework in the Emergency, Chronic and Critical Illness Fund that will liberate the people of Kenya from the burden of catastrophic hospital bills in the treatment of conditions like cancer, diabetes, hypertension, and other critical and chronic conditions. Additionally, the new funding model that is fair, equitable, and progressive will see the government of Kenya, for the first time, pay the cost of health insurance for all vulnerable Kenyans who have no ability to pay. Those currently paying $500 will have their contributions reduced, with the least paying Kenya shillings 300. To enhance efficiency and eliminate pilferage in the healthcare system, the new digital law will underpin the digitization of the entire health service delivery framework. While empirical evidence, ladies and gentlemen,